Drug courts are a topic of hot debate in today's society. Some believe they are an effective alternative to incarceration sentences for those struggling with substance abuse, while others believe that is a waste of federal grant money as to that the success rate of graduates in drug court programs varies too much across the nation, thereby implying that it only works some of the time. The fact of the matter is this. Drug courts are the newest program established in the United States that aim to rehabilitate clients of the program from their substance abuse. Let's look at the history of drug courts. It was the 1980s and many U.S. courts were stretched to the limit and packed with drug cases daily. By 1989, the judges in Miami-Dade County in Florida were exhausted of seeing the same people repeatedly come before the bench, and something had to be done. As a result, the county established the nation's first drug court. Eventually, a prosecutor, a judge and a public defender in Miami-Dade decided if an addict should be admitted to its new program. For their part, the defendants had to agree to be tested for drugs and seek treatment in private or public-run facilities. The offenders were obligated to see a judge during each step in the year-long process, which included more counseling sessions and more drug screenings. Once other states began to hear stories of the Miami-Dade drug court success and decided to set up their own systems. Today, there are more than 3,000 drug courts in the United States. Now that we've talked about the history of drug courts, let's look at what drug courts actually are. Drug courts are specialized court programs that help a range of criminal defendants and offenders, from juvenile to adults, to families with pending child welfare cases who have alcohol and other drug dependency problems. For the clients a part of drug courts, their drug dependencies range from methamphetamines, heroin, cocaine, marijuana, stimulants, and countless other opioids. The main goal of drug court is to help those with a record of criminal offenses for possession, use, and distribution of alcohol and drugs while overcoming drug and alcohol dependency problems while keeping them as functioning members of society. Drug court systems differ from the traditional criminal court in many ways. For starters, in drug court, all the authorities, whether it be a judge or a defense attorney, all work together to devise the best plan for the person involved in the trial. The components of a drug court which are involved in a case are judges, prosecutors, defense attorneys, probation officers, treatment controllers, police officers, and many more. The method of working within a drug court is an effective, yet simple way. The courts are to provide treatment for all kinds of drugs and alcohol, and the treatment plan is devised according to the need. Abstinence or quitting is monitored by using drug screening tests or alcohol tests performed after some interval. If the participant is found to be non-compliant, there are strategies that can decide the course of action according to the level of non-compliance. It should be stated that relapse is considered a normal action, but non-compliance can be considered a criminal act. Attending court for judicial proceedings is an important part of the plan, but if the person involved fails to show up, then there are penalties for that, such as sanctions of community service, extra meetings with supervisors, or even jail time. Take a look at the sanction of one client in the Manitowoc County Drug Court Program.
All right, Brian, you're going to be here next week, all right?
Okay.
The team is going to be considering every option available to it. And because of when this occurred, this team needs time to digest it and process what we're going to do. At this time, I have made a decision. Until this court further consults with members of the team, my own decision of having taken into custody at this moment is very concerned. And how long we stay will be determined by the team that being consulting with them, that they're going to be taken into custody at this moment.
Addicts are also educated and made aware of the effects of drugs or alcohol on them, their families and society, and they are made to interact with other people in rehab to encourage. The question remains, what is the cause of the sharp increase in drug courts across the nation and in Wisconsin? According to one report from the Wisconsin Department of Health Services, heroin-related deaths and hospital visits have increased due to heroin's easy access, high potency, and low cost. The overprescription of legal opioids like Oxycontin and other pain medicines have led to unintended consequences for users. Legal opioids are often overprescribed and illegal opioids are often easily accessed, causing them to be abused at a higher rate than other drugs. Those exposed to these powerful drugs can become addicted and cause users to continue using drugs beyond the doctor's prescription. Today, if the patient's prescription runs out and the person is addicted, it is easy for them to find relief in illegal drugs like heroin. Opioids are also available in every drugstore and doctor's office across Wisconsin, and with this availability, it is much more likely that people will become dependent. This increase in easy availability has led to the increase of drug courts established across the country. Let's now turn over to the magnitude of the substance addiction and the increase in drug courts. Over the past few years, there have been multiple reports that Wisconsin has suffered from a drug epidemic, with a variety of reports and data to show the long-lasting impact on local communities. Additionally, the report from the Wisconsin Department of Human Services found that between 2006 and 2016, the rate of drug overdose deaths in the state from opioids rose 81% from 5.9 to 10.7 deaths per 100,000 people. Additionally, Wisconsin ranked third in the nation in 2014 for binge drinking prevalence, and there were 25,229 drug-related arrests in 2014, and 12% of the people arrested were juveniles. The annual Wisconsin Death Report from 2016 shows that the total number of drug overdose deaths significantly increased from 872 deaths in 2015 to 1,031 deaths in 2016. Some of the drugs that may have caused overdoses to include cocaine, Xanax, Adderall, and Ritalin. With the increasing rate of heroin use and subsequent increase in opioid-related deaths, the Manitowoc County Circuit Court system decided to implement the Manitowoc County Drug Court program in the fall of 2017 to help people suffering from drug and alcohol addiction. Who does it impact? How does it impact the broader society, and why? With the low costs of drugs and easy availability, not only can the general public be hooked on opioids and illegal drugs very quickly, but this matter can trickle down into the youth of society and worsen their future. Perhaps one of the most important and far-reaching effects of a drug court is the positive impact it has on families who have been negatively affected by their loved one's addiction. These families often face poverty, strained or broken relationships and separation from spouses or parents. Drug courts provide the opportunity for families, adults, and the juveniles the opportunity to clean up their lives and be able to get a new start in life. Drug courts' impact on addicts has been shown to increase rates of employment, help people obtain stable living arrangements, improve mental and physical health, and enhance interpersonal relationships. What are the debates about the issue? Drug courts have high initial costs, especially those associated with treatment. However, savings associated with the criminal justice system come from fewer crimes committed, rearrests and incarceration. Let's look at the pros and cons of drug court programs. Some of the positive aspects include: they provide judicial supervision and the fear of penalties and arrest due to substance abuse or recidivism, which ensures compliance to a great extent. Drug courts save taxpayers money when the money spent on dealing with drug problems is compared to the amount spent on crime control and criminals. Drug courts help rehabilitate people who suffered previously because of addiction and restore families who had been torn apart due to their addiction. Meanwhile, some negative aspects include: there is no standardized strategy, planning, and service that differ from state to state even within the same country. There are few considerations to personal habits if a person is hesitant in taking any test, suffers from anxiety, or cannot attend the court due to some personal reason. In their hurry to get a person back into society, the drug court officials might neglect the level of stress the person can take, leading to recidivism due to stress. All these factors can sway the public's opinion of drug courts, but what matters is the importance what drug courts offer. With the low costs of drugs and easy availability, not only can the general public be hooked on opioids and illegal drugs very quickly, but this matter can trickle down into the youth of society and worsen their future. Drug courts provide the opportunity for families, adults, and the juveniles the opportunity to clean up their lives and be able to get a new start in life. Additionally, drug courts provide the option for rehabilitation, while plain incarceration provides little to no hope for people to be rehabilitated. While it is not impossible to be rehabilitated by just incarceration, the lack of connection to society plays a major role in how people feel about themselves. And if addicts feel less of themselves, they are likely to retract into previous habits of addiction. By successfully completing this voluntary program, individuals have the potential to avoid criminal penalties and even have the arrest erased from their permanent record. Drug courts represent a criminal justice approach that takes into account the need to ensure public safety through close supervision, and public health through the delivery of community-based treatment. The relevance of drug courts to social work. What is the relevance to social work and how, why? Drug courts offer alternative sentencing for individuals with drug-related criminal charges, and although there is no mandate requiring a social worker to be a member of the team, social workers play a unique purpose on the professional team resulting from their generalist and specialist knowledge and skills. Since the mid-1980s, social workers that work on the front line have witnessed the rise of families with drug involvement entering the child welfare system. It should be reiterated that drug courts are centered on the individuals involved and that social workers work with clients individually. They seek to address the complex needs of the clients, not just their substance abuse problems, through intensive case management done by the drug court team. These conceptual distinctions are relevant from a social work perspective that views the individual as influencing and influenced by their surroundings, including family and community. Social workers who refer clients to drug courts must take extreme caution not to put pressure on a client in crisis to enter a drug court without providing adequate information. How does the profession of social work view drug courts? Social workers may serve on drug courts teams as administrators, substance abuse treatment professionals, child welfare workers, or other stakeholders. Because social workers provide a large share of community and social services across the United States. Social workers may also be involved with drug courts tangentially as mental health, domestic violence, or family training providers who work with drug court clients. Because of the presence of social workers in drug courts and surrounding communities, it is pertinent to the social work profession to ask if drug courts are the best practice for substance abuse-affected individuals. Drug courts implement social work, in that value is placed on building relationships with clients, the approach is collaborative and non-adversarial, and case plan goals seek to meet the needs of the whole family and their environment. If these courts continue to perform essential social work without adequate social work personnel, ethical issues arise. Policymakers should consider mandating the presence of at least one trained, licensed social worker on each drug court team. With their long history of working with and advocating on behalf of disadvantaged populations, social workers can advocate at the local level for the creation of drug courts, mental health courts, and other projects that divert people with substance abuse disorders and mental illness from the criminal justice system. At both the state and federal levels, social workers should work to influence change in social policies regarding substance abuse, mental health, and criminal justice systems. We'll last turn the focus towards the National Association of Social Workers, NASW, Code of Ethics. The 6 professional values of the National Association of Social Workers Code of Ethics are: 1. Service, 2. Social justice, 3. Dignity and worth of the individual, 4. Importance and centrality of human relationships. 5. Integrity. 6. Competence. Of the 6, the two values that best relate to drug courts are social justice and the dignity of the worth of the individual. The social justice value, which includes economic justice and human rights, relates to that. In order to maintain a fair and just justice system, it is important to maintain impartiality and fairness in a court system like a drug court. While drug courts are still gaining recognition and are still fairly new, they must still hold the fairness of helping the clients while giving proper punishment when clients screw up by testing negative to a urine analysis or missing a meeting or breaking sobriety. Additionally, the value of the dignity and worth of the individual pairs hand in hand with social justice. While the court system should take every case seriously, maintaining the proper respect for every client and member of the drug court needs to be of the utmost importance. Additionally, the support system established not only by the public but also by the members of the program, in order to help maintain the fact that just because these clients are still functioning members of society regardless of the offenses they have committed. Drug courts are at the center of what is the most effective way to rehabilitate substance abusers. With the 3,000-plus drug courts established across the nation, the way of how to rehabilitate abusers from a social work viewpoint is gaining notoriety. The only thing that is left to answer is this: will society catch up with a new way of rehabilitation, or will they stick with the old times of prison as the only answer? I guess we will have to wait a few more years to figure that one out.